In the early stages of the COVID pandemic, British Prime Minister Boris Johnson stepped onto the doorstep of number 11 Downing Street. He did not look at all well.
Okay, thanks NHS, thank you.
It was the 2nd of April 2020 and Boris Johnson was the first world leader to contract COVID-19. But, he said, he was feeling fine.
Alas, I still have one of the symptoms, a minor symptom of I still have a temperature.
Within days, Johnson was in hospital fighting for his life.
The Prime Minister moved into the intensive care unit of London's St Thomas Hospital.
It was a strange time. I remember people speculated that Boris Johnson might not make it. But as we all know, he did. And don't worry, today's episode isn't about COVID. No one wants to relive that. It's about an institution that one former Chancellor called the closest thing the English people have to a national religion. The National Health Service.
I've today left hospital after a week in which the NHS has saved my life. No question.
Johnson was so pleased with the NHS after his COVID scare that he did his favourite thing, impersonating Winston Churchill.
We're making progress in this national battle because the British public formed a human shield around this country's greatest national asset, our National Health Service.
He said that by staying home and following lockdown rules, the British public had saved the NHS.
If we could stop our NHS from being overwhelmed, then we could not be beaten.
Soaring rhetoric aside, COVID had overwhelmed the NHS.
With the death toll across the UK from COVID-19 now more than 43,000.
In fact, the UK was seeing by far the highest death toll in Europe. Boris Johnson was Prime Minister during one of the most terrifying and deadly periods in British history, far deadlier than the German bombing raids during World War II. It's easy to blame Boris Johnson for the high death toll, and many people do. They say that he waited too long before putting the country in lockdown and then relaxed restrictions too early. His decision to attend office parties while the British public was confined to their homes makes it particularly easy to hang the blame around his neck. But I don't think that is the whole story. The reality is, the NHS, the thing that Johnson called Britain's greatest national asset, was already in crisis before the first COVID patient arrived in England. By many, many metrics, the NHS was deeply, deeply broken. And that's not Boris Johnson's fault. In fact, he was trying to fix it. Today, the story of how Britain's beloved NHS fell into disrepair, leaving it on the edge of collapse as a catastrophe hit. I'm Matt Bevan, and from If You're Listening, this is Who Broke Britain. With polls indicating that Labor is headed towards a landslide victory next week, it's worth looking back at the first ever Labor landslide in 1945.
The news is that there is a big swing to the left.
With World War II ending, Labor trounced Winston Churchill's Conservatives and won a mandate to bring about massive policy change. The biggest and longest lasting change was Britain's beloved NHS, and it was created by a Welshman named Aneurin Bevan. Aneurin Bevan, and yes, we are very distantly related, grew up in the valleys of South Wales, and that means that every male in his family was a coal miner. He would also follow his father and his father's father into the mines, but not before he made it clear that he was a little bit different.
Some of the most vivid hours of my life. I remember reading at home the books I used to get from the library.
Aneurin, or Nye to basically everyone, kept running into limits for how many books he could borrow. So he set up library cards for his siblings.
I was a member of a large family and I used to use their names to get a lot of books for myself.
He left school and went down the mine at 14, and by 19 was the boss of the local union lodge. He raced up the ranks of the British trade union movement with his writings published in socialist papers around the world. By 32, he was the local Labour MP and won every re-election campaign for the rest of his life with around 80% of the vote. He was a hardcore socialist and clashed with just about everyone who wasn't. Churchill famously described him as a projectile discharged from the Welsh valleys. Surprisingly, the projectile landed in the cabinet room.
Newspapers carried the astonishing news to an amazed public. For let's face it, whoever imagined such a result? And slowly the moral of it all struck home. Labour landslide.
After the Labour landslide in 1945, Bevan was surprisingly added to the cabinet as health minister. Some speculate that the leaders thought it was better to have him inside the castle rather than firing a cannon at it from the outside. At the time, the British health system was a bit of a mess.
Hospitals were built haphazard according to the varying foresight and resources of many different authorities, with extremely patchy results.
Some hospitals were run by charities, some were run by local governments, some were run by insurance companies, and this meant that richer parts of the country got far better care than poorer parts.
Some places were well off for hospitals. Others were unlucky.
Nye Bevan was handed a blank cheque to fix this, basically a socialist's dream.
And I wanted, therefore, to use the National Health Service as an instrument for the redistribution of a national income.
His proposal was extraordinary. All of Britain's hospitals would be nationalised and come under the control of the health minister. Every doctor in the country would become a government employee and draw a salary. Using around 5% of the government budget, healthcare would become free for everyone in Britain. Not just taxpayers, not just British citizens, everyone.
Just suppose you fall off your bike. You might have concussion as well. You'd be carted off in an ambulance, which might cost a couple of quid. And then you'd have to pay the hospital too. The new health service would cover all this.
There was massive opposition to this from doctors, specialists and hospitals, who up until this point were all their own bosses. But with a combination of throwing money at them, steamrolling them and compromising with them, Bevan brought them around.
And there is nowhere in any nation in the world, communist or capitalist, any health service to compare with it.
The scheme would kick in on the 5th of July 1948. Bevan was on the verge of becoming a national hero, and he had a real shot at becoming the next Labour Prime Minister. But on the 4th of July, the day before the beginning of the NHS, Nye Bevan reminded everyone of who he really was, a projectile discharged from the Welsh valleys. At a rally in Manchester, he started talking about the Conservatives, the Tories, and said, should I do my Welsh accent for that? Well, just don't use it if it doesn't work. No amount of cajolery and no attempts at ethical or social seduction can eradicate from my heart a deep, burning hatred for the Tory party. So far as I'm concerned, they are lower than vermin. The crowd may have loved it, but politically he had shot himself in the foot. Winston Churchill hammered him with it every chance he got. For years, young Tories started vermin clubs. The Labour Prime Minister publicly condemned him. At the time, it totally overshadowed Bevan's NHS achievement. Even the Australian papers reported on it. It was huge. But Nye Bevan's troubles weren't over. The NHS, it turned out, didn't cost 5% of the national budget, it cost 10%. Millions of poor people with long-term ailments came out of the woodwork now that healthcare was free.
There has gone on in the past a vast amount of silent suffering, a vast amount of remediable pain, and I believe in Great Britain we have made a great start.
When the government tried to claw back some of the money by making people pay for half the cost of false teeth and eyeglasses, it was the last straw for Bevan. He rage quit over dentures. But his legacy, the NHS, endures. Politicians and the public alike defend the NHS passionately, and yet governments are constantly surprised by its cost and try desperately to find ways to make it cheaper. Three things have been rising in parallel since the 1970s: Britain's median age, Britain's life expectancy, and the cost of the NHS. But in 2010, two of those things changed. David Cameron had intimate experience with the NHS. His eldest son Ivan was born with cerebral palsy and a form of severe epilepsy, and needed round-the-clock care and frequent hospital visits.
But when your family relies on the NHS, day after day, you realise just how precious it really is.
In 2009, Ivan died at the age of 6.
When such a big part of your life suddenly ends, nothing else, nothing outside matters at all.
Throughout the 2010 election campaign, his message to voters was that he understood the importance of the NHS and he could be trusted with it. When elected, he promised to isolate the NHS from the austerity program that he was rolling out across Britain.
We said 5 years ago we were the party of the NHS, and now in government, by protecting the NHS from spending cuts, we are showing precisely that priority we've talked about so much in our party.
And that's true. The NHS budget did not decrease. Instead, it flatlined. But the need for NHS services didn't flatline. Britain's ageing population meant that more doctors, nurses and funding was needed every year to maintain the same quality of care. Waiting lists began to grow. Overworked staff began quitting and the NHS was unable to find replacements for them. The Labor Party began to attack Cameron for creating a crisis in the NHS.
We've got ambulances queuing outside our accident and emergency units. We're missing the targets for cancer treatment for the first time ever. And to add to that, we had a tent erected in a hospital car park to treat people in 2015.
Cameron angrily denied it.
I'm someone who knows what it's like when you go to hospital night after night with a sick child in your arms, knowing that when you get there, there were people who will love that child and care for that child just as like it was their own. And how dare they suggest I would ever put that at risk for other people's children? How dare they frighten those who rely on a national health service?
But the figures speak for themselves. The median waiting time in English emergency rooms went from 2 hours and 9 minutes in 2011 to 2 hours and 55 minutes in 2019. The length of time that cancer patients had to wait from diagnosis to treatment increased significantly. And for the first time in modern British history, life expectancy stopped going up. In fact, for Britain's poorest people, particularly poor women, it began to go down. Surprisingly, the person inside the Conservative Party who seemed most aware of the situation was Boris Johnson. In September 2019, Omar Salem was in a hospital in East London. He had brought in his 7-day-old daughter who had been admitted through the emergency room. Once they arrived on the ward, Omar says that he had to wait for hours before a doctor was available to see his daughter. Omar Salem, who just so happened to be a Labor activist, was livid about this. He knew that the staff were doing their best, but there just weren't enough of them. Then, as he was standing outside his daughter's room, who should wander by but Prime Minister Boris Johnson and a camera crew.
Good morning. Hello, good morning.
Johnson was in man of the people mode, with no jacket on, his tie tucked in between his shirt buttons and his hair extra messy.
It's a ward primarily for elderly people.
He was there to hobnob with the doctors, nurses and patients. Omar started walking beside him.
My daughter nearly died.
My daughter nearly died, he said. Then he turned, looked the Prime Minister in the face and let him have it.
There are not enough people on this ward. There are not enough doctors, there are not enough nurses. Right. The NHS has been destroyed. It's been destroyed. It's been destroyed. And now you come here for a press opportunity.
In a rather strange turn of events, Johnson said while standing quite close to a film crew with camera shutters snapping.
Well, actually, there's no press here.
What do you mean there's no press here? Who are these people?
Johnson said, "We're actually here to find out what we can do." Omar told him it was too late.
Well, that's not going to fix things now. It's a bit late, isn't it?
He was right. It was a bit late. But then Boris Johnson did at least understand that the NHS needed money urgently. For years, he had been demanding increases in NHS funding, often as a way to wedge his opponents inside the Conservative Party and further his campaign to become the Prime Minister.
Including on the National Health Service, we can take back control.
By the time he was ambushed by Omar Salem in the East London hospital, his government had laid out a plan to boost NHS funding.
We are doing 20 new hospital upgrades in addition to the 34 billion more going into the NHS.
But as Omar said, it was too late. The NHS was in a state of crisis right as the pandemic struck. 3 days before the first anniversary of Britain's first COVID case, Boris Johnson made a grave announcement.
I'm sorry to have to tell you that today the number of deaths recorded from COVID in the UK has surpassed 100,000.
Life expectancy, stagnant for a decade, actually began to go backwards for the entire population, thanks to COVID. For the first year and a half of the pandemic, the UK had the highest COVID death toll of any major economy. Right now, there is a massive inquiry underway into how the British government handled COVID-19. Boris Johnson and David Cameron have both given evidence. Johnson quibbled with the lawyers over the death toll.
I'm putting to you some cold steel of evidence.
I don't believe that your evidence stacks up.
And David Cameron flat out denied that his austerity measures contributed to the NHS's poor performance during the pandemic.
Do you accept, Mr Cameron, that the health budgets over the time of your government were inadequate and led to a depletion in its ability to provide an adequate service?
I don't accept that.
He said that austerity cuts were essential. We'll see what the inquiry says, but essential is a matter of perspective. For 75 years, Britons have been adamant that a well-functioning NHS is essential. And that's something that the government hasn't been able to give them.